Welcome everyone to Every Woman Empowered's Chit Chat. And I am your host, Shauna J. Cerniak, the founder of Every Woman Empowered. And today we have my co-hosts,
Gianni Gallardo, international artist and resident artist of Every Woman Empowered.
Neela Jadil, certified laughter yoga instructor, founder of Let's Laugh Yig, and happiness ambassador for Every Woman Empowered.
And our special guest today is Dr. Briana Botsford, who just recently opened up her own clinic here in Edmonton in July. So welcome, and she is a naturopath doctor. So welcome, Briana.
Thank you.
Yeah.
We're so excited to have you here, and I know we have lots and lots of questions because you really deal a lot with women's health, and I know the three of us have really come up with some great questions for you today, and I'm excited to hear the answers.
Awesome. Yeah, I'm excited to be here. Thanks for having me.
Oh, you're welcome. Thank you.
Well, we're thrilled. So I'm going to start us off right away here. I want to know why we should go to a naturopath versus a traditional doctor, and what are the differences?
Absolutely. So the way I see the difference between naturopathic doctors and medical doctors is that we obviously use natural therapies and not medications. One area of my focus, and most naturopathic doctors will probably agree with me on this, is that we work on treating the cause of health issues and work a lot with things that are considered to be common, but are not necessarily normal. So it's not necessarily that you must choose between a naturopathic doctor or a medical doctor. In Alberta, naturopathic doctors are considered to be primary care providers, which means that we can do the same sort of things that are necessary from a primary care perspective. But my preference is actually not to replace a medical doctor at all. I like to work with the medical care team, and I think the patient gets the best quality care that way when we're able to work as a team. And yeah, so we're not looking to like replace medical doctors or conventional medicine. It's more to work together in combination with a medical treatment approach if there is one. And then some patients will prefer to use natural remedies, whether that is lifestyle change, so nutrition, exercise, sleep hygiene, all these sorts of things, or if they're looking at a nutritional supplement, things like herbal remedies or even acupuncture. Those types of therapies are things that we do as well. So it just depends on what the patient's needs are, but that would be the main difference between a conventional medical doctor and a naturopathic doctor.
Love
Awesome.
that.
Thank
I'm
you.
glad to hear that you are working and collaborating with other doctors. I mean, that's huge, right? Because there are times, like you said, where people are going to need that other medical care, and by working together, you're doing the best holistically and as well medically together. And I love that you're working that way, because there's a lot of other doctors, naturopathic doctors or doctors in general, that don't cross over on that side. Do you see that?
Yeah, definitely. Like the way I joke about it is that, I think it's important that we play together in sandbox well, and, that we have to, because at the end of the day, it's your patient's care. So it's not about also medicine in general is not about belief. It shouldn't be, it should be about care and what's best for the patient, not what, beliefs should not really come into it as much. Obviously, different patients are going to have different preferences and their backgrounds and their beliefs and that kind of thing, and we need to work with that. But as far as when I hear from someone who says, oh, well, my medical doctor doesn't believe in naturopathic medicine, I'm like, well, it's not like Santa Claus, we're here. So, and, at risk of sounding rude, I do have a lot of family doctors that do refer to me because they know that I'm not necessarily, going to take over the whole case or anything like that. We do have to work together. We need to collaborate so that the patient can get the best care possible. And whether that means, they're taking a couple natural health products, or, I'm giving them some more nutrition or lifestyle advice. I have the luxury of time in my practice because my visits are My initial visit is an hour. My follow-up visit is usually half an hour, 40 minutes. So that gives me time every visit to go over a lot of things with each patient, whereas medical doctors don't have that luxury, and that's not necessarily their fault. It's partially the way our system is structured and billing is structured. And so, you know, I create my schedule the way I want it, and I bill privately. So private insurance covers what I do for patients who have extended coverage, but for a lot of patients, it's out of pocket expense to come and see me. So that allows me to have the luxury of time to go through that whole patient care and the whole person. But they still will need their medical doctor. And if we can be on the same team, that's fantastic.
Exactly. So I know with women's health, I find that a lot of our women's health issues get brushed under the table, and I've experienced even in my lifetime, where, you know, it's like, oh, you've had a baby, well, that's just because you had a baby, or, you know, it's menopause, or it's that time of the month, it's your period, you know, that it's just the way things are. And I find that there's a lot of misconceptions in the industry on women's health, and I want to know, what are you doing to make that difference with women's health and addressing those kind of misconceptions?
I think the biggest thing that I'm trying to do is educate women. And that doesn't necessarily mean like, you know, we don't know as women what's going on. I think we know what's going on in our bodies, and we live in them every day. So we know when something is not right and when something is out of balance or what have you. You know, you are the expert in your body and what's going on, and what we have to do as clinicians is figure out, what does that mean when we have to sort of like be a detective and interpret that. And I think like what happens a lot of the time is most of our research in healthcare, in medicine, is done on men. So now we're starting to get more and more evidence and research in, you know, it could be anything. Like we could talk about heart cholesterol medications, and we're starting to find more data specifically with women versus men. And there are vastly, you know, spoiler alert, there's different outcomes. So women are different, and we are no longer satisfied with that as women, not necessarily as healthcare providers. Like, I think healthcare providers are also starting to get hamstringed, because we're like, there's just not the information. I believe you, this is real, but I don't know what to do because the study hasn't been done. So we're starting to get that information. We're starting to learn more. We're starting to understand these more complex conditions that women are experiencing. And then on the flip side, like, you know, it's like what I said before, it's also things that are common, but not necessarily normal. So like menstrual pain, like we would say, like, that's common. Like, I just thought, you know, it's normal to have menstrual pain. But then now we're talking about it. Like we're okay to jump on social media and be like, oh, like I had cramps for 5 days and it was terrible. And people are like, that's not okay. And other women are like, really? It's not? I didn't know. And so it's good that we're having these conversations, and we're more like, you know, the sort of taboo around periods and menopause and all these things that women deal with are sort of being broken down.
Right.
Because that way, like, we're able to communicate about it. And that's something I feel really strongly about is like, on the one hand, making people feel comfortable, but on the other hand, educating, like, this is common, but it doesn't have to be normal. This is, you know, your pain doesn't have to be normal. It's not normal to take, you know, naproxens every 4 hours for 5 to 7 days a month. You're going to wreck your stomach. Like, you know, like these sorts of things that are just sort of, yeah, in a sense swept under like, oh, well, that's just because you're a woman and you have a period. Like, women are like, no, I'm not okay with that answer anymore. And so we have to get better at treating it. Yeah.
Exactly.
Yeah. I mean, I can't speak to menopause, but a lot of women my age, we're coming off birth control. Many of them are having miscarriages or trouble getting pregnant. I mean, of course, there's so many various factors involved in all of that, but is there any advice you can kind of share with our viewers going through those sort of things?
Yeah, definitely. I think I think that's a good point, is that birth control is sort of like in like basic medicine, it's like a panacea. It's like, oh, you have period problems, take birth control. And we do that for so long in women's lives. And, you know, I don't want to belittle birth control, because as a feminist, I think it's amazing that we have a way to manage our fertility. I know that there are also a lot of other ways that we can manage our fertility. If birth control, if we're using it to specifically for the purposes of contraception, like, okay, cool, your choice. But as you said, many women have been on birth control for 10, 15, 20 years by the time they're trying to conceive, or they're on it their whole menstruating life. And then they're like, am I in menopause? I'm not sure. Maybe we'll try stopping the birth control, just see what happens, like roll the dice. But like with coming off of birth control specifically, and then looking to get back to some kind of regular cycle, the data tells us that it takes between 6 and 9 months to achieve a regular menstrual period. So I don't see the women, I'm biased because I don't see the women in my practice that come off of birth control and like are totally fine, because they don't need me. They're fine. So I see the women who come in and haven't had a regular cycle come back within that 6 to 9 month time frame, or even within a 3 month time frame. And I think like the most important thing, especially with respect to fertility and trying to conceive, is that we recommend that women come off of birth control earlier than when they want to be pregnant. Because a lot of what I see in my practice is women stop the pill and they're like, okay, I'm going to be pregnant tomorrow. And that happens, but not very much. So it's more common to be looking at like needing to come off of the pill and using other methods of contraception for a few months, even up to a year, to sort of get the body ready to carry a pregnancy. And then there's also like a whole bunch of conditions that, like you mentioned, like there's so many factors, and there are underlying menstrual health conditions that may not have been diagnosed 15 years ago or 10 years ago when that woman started the pill. And so that will actually impact her ability to carry a pregnancy to term. So we want to look at those diagnoses and say, like, does this patient have polycystic ovarian syndrome, or does this patient have endometriosis, or one of these health concerns that we need to treat in order for them to have a healthy pregnancy? And I mean, my main advice would be, come off the pill early, use other methods of contraception, and then nourish yourself. Like, you're going to be growing a tiny human, so if that's your goal, right? So you need to have all those nutrients in place. So lots of vegetables, fruits, healthy fats, high quality proteins. Like, it's nothing earth shattering, but those things are really important. And something as simple as starting a prenatal before, well before you want to be pregnant, just to get those nutrients in and get those levels up. Those are really like simple, basic things. The ones that nobody likes to hear are like, cut back on alcohol and watch your caffeine intake. And, like, those are the ones where people are like, hey, bye.
Yeah.
So, like, I'll take the prenatal vitamin, and I'll eat some more vegetables. I'll do the smoothie, but I'm not gonna change those other things. Okay,
yeah, take the prenatal vitamin with a glass of wine.
Yeah.
So
Yeah.
for those who aren't aware, myself, I found you, Dr. Briana, on Instagram, and I started following you, and I loved how you empowered those that are following you on Instagram with knowledge. And one of the topics that you talked about was about vaginal dryness, and I was so intrigued by how you addressed it and how you just made it something so common on Instagram and comfortable for the viewers to speak. And that's how I even myself contacted you. And I loved how, like I said again, the empowering with the knowledge. You told us about, that it's common, that it is something that as women we experience with. And when I talked to you privately, I just kind of messaged you and said, right on, thank you for just putting it out there and letting us be aware of it and empowering us with that knowledge. And then when we started to talk about incontinence, and I shared with you my personal story about my own incontinence, and through you educated me into an area that I had no idea about, even though I was dealing with a variety of doctors, even though I was getting some medical attention to my issue. But then you brought me into a whole new world about incontinence and what it was about, and how it's very common. And it's not just about when you have a baby, or that you can become incontinent because of a variety of issues. And I want you to kind of share some of that knowledge with our listeners and viewers right now, because I tell you that by your expertise and just guiding me has made a difference in my life. And I would love for you to kind of share that knowledge with our viewers.
Yeah, absolutely. I mean, I think, this is something that I always ask about in my visits. Do you have any difficulty with urination, or when you jump or run or laugh or cough or sneeze, do you get any leaking? And it's just because if you don't ask, nobody's going to tell you. So you have to ask. And then the reason that I talk, and that's also the reason why I talk about it on social media, is because not everyone's coming to see me, but everyone deserves to have that knowledge. So, we're finding, I wanted to pull up the study, the citation, but I don't have it handy, but there was a research I saw the other day that was looking at incontinence in high school basketball players. So we're seeing it in women who have, are young women, we're seeing it in older women, we're seeing it in childbearing years, like it's across the board. And it all has to do with pelvic floor health. So what we're looking at from my perspective typically is, okay, I need to make a referral to a pelvic floor physical therapist. And we are so lucky in Edmonton, where I am, we have so many amazing pelvic health physiotherapists here. In Australia, after childbirth, it's a standard of care for a woman to see a pelvic floor physio.
Wow.
And it's incredible. I mean, that's their standard, is like after, so how here we have our 6-week child, like postnatal checkup, and your doc's like, looks good, you're good to go. In Australia, it would be a pelvic health assessment, which is like a pap smear on steroids. So basically, it's not just like a swab and they're done. It's a full assessment of all the muscles of the pelvic floor and how they're functioning. Because sometimes with incontinence, we're having people always think, well, I just need to do my Kegels. And, it's not always a weak pelvic floor. It can be a too tight pelvic floor that's not allowing complete bladder emptying or even fecal emptying. And then we're having issues with I just went to the bathroom, why do I have to go again? Probably you're not emptying your bladder all the way. But we can't know that unless we check. And we can't check unless we really do a thorough assessment, which is not something that I do, but I refer my patients for pelvic health physical therapy. It's intimate, but it's important. And it really helps to uncover what's causing the issues. Even things like constipation can be caused by a pelvic floor that's not functioning as well as it ought to be. So, yeah.
Yeah. And I am in my menopause years right now, and that was part of what was contributing, besides another issue that I had prior to this. And I wasn't even aware of this, that this was something that can be common. And since this time, I've been sharing the news, going out there, talking to people and telling people. And it's amazing how many women are like, really? Like, it's not like, so this, when you laugh and you pee a little, we all make a joke about it. We've seen the magnets, we see the little cartoons, but it's not a joke, and it's something that should be dealt with. But we've been told again, well, you had a baby, or, whatever, muscles weaken. Mm-hmm. And when you shared that experience about, saying to me, have you even looked at physiotherapy? And I'm like, physiotherapy? Yes. Blew me away. And the young lady that I am dealing with for my physiotherapy has been wonderful. And I just really want to thank you, because you have made a difference in my life. And I'm really glad that I took the time to message you, and you guided me. So thank you for that.
That warms my heart. I'm so glad that you're getting the help that you need and that it's going well.
Yes, thank you.
You know what? More information is always a better thing.
It is. Like I said, it's empowering.
Empowering, yes. We don't need to be left in the dark. And I'm just going to kind of segue right into that to talking about, some women, when they're going through menopause, have a really rough time. And the resources and that sort of stuff, you really have to search it out. It isn't just kind of given to you. You're supposed to somehow understand that all these changes are going to happen to you, or not happen to you, or maybe some of them happen to you. Do you have any advice about what women should be doing during menopause and that sort of stuff?
Yeah, absolutely. I think the first thing to know is whether you're experiencing hormone changes, you're in your late 40s to 50s, or if you're anywhere in that age range and you're like, something feels weird or different, you're not crazy. Like, that's the first thing.
Yes.
It's not just you, like, you're not nuts. It's not in your head. It's real. And that's like the first step is to acknowledge that you're not nuts, because I think that it causes a lot of stress. People are like, I don't know if it's all in my head. I'm like, no, it's not. It's okay. It's real. And I mean, we know that with menopause, we have estrogen receptors in our brain, and as estrogen declines, that can affect our cognitive abilities. So we can have more brain fog. It can cause depression. There's an incredible amount of women in menopause that go on antidepressant medications when, like, ultimately at the end of the day, if we're looking at the cause of the depression, it's hormone mediated, not serotonin mediated. That doesn't mean they don't need the medication. The medication might be necessary. That's fine. But we should also look at what's going on hormonally. I think so. The first thing, no, you're not crazy. The second thing is get help, right? If you need it. Like, if things are disrupting your life, like, I have patients sit across from me every day and tell me, like, they're hot flashing in their business executive meetings. Like, right now it's not so bad because most people are working on Zoom and it's like, whatever, shorts on the bottom, business on top. But in real life, if they have to go into the office, they don't want to be drenched and uncomfortable every time they experience a stressful situation. If anything is interfering with your quality of life or your sex life, like vaginal dryness, like we talked about, as estrogen declines, that affects the vaginal tissue. Depression is such a big one, brain fog, especially, for any woman, but like, if your job is cognitively demanding, or like just in general, like, why should we just say that? Like, anyone can have cognitive impairment and suffer. Like, it doesn't matter what your job is. So, it's important to get help. And I also always recommend, there's a really great resource called Menopause Chicks, and she did a book called Mokita, and it's available online. Like, you can just pay, I think it's $10 and download the PDF, and it's pretty good. Like, she has a lot of good information in there. She talks about naturopathic doctors, acupuncture, all the different ways that we can treat menopause. And menopause is not a disease. It does not need to be treated like a disease. It's the symptoms of transitioning your hormones are uncomfortable and can impair your quality of life. And if that becomes the issue, we need to treat the symptoms. It's not like, oh, we want to just get rid of menopause. It's like, it's going to happen. It's natural. It's okay. It's just that we don't want to have it ruin our lives. So, yeah.
We still want to be able to live our lives to the very fullest,
Exactly.
just because we're going through menopause. I mean, really. One of the things you didn't talk about was sleep.
Yeah.
I know for a lot of women, I know for myself.
What's that? Sleep?
I don't know. Although I have to say mine is getting better now, but oh my gracious. And I don't know too many people who can function really well when they don't have a good night's sleep.
No, you're right. And it's very rarely with menopause, it's very rarely sleep onset insomnia. So it's not really that they're having a hard time falling asleep. It's that we're having a hard time staying asleep. And there's this, I call it the progesterone witching hour. It's just a joke. It's between like 2 and 4, when all of the world's women are awake and we're gonna like take over the world. Like, that's when the revolution happens, ladies. Like, meet me there.
We are prepared.
Right? Because we're all like awake, like, okay, dude, like literally solving the world's problems, or doing whatever, or worrying about the world's problems is more like it, and I think that shows us that there's a hormonal disruption that's affecting our sleep. And sometimes it's a hot flash, sometimes it's night sweats, those are things we can treat, and that will help the sleep. But sometimes it's just like, boing, I'm awake, what the heck, like, I might as well get up and start my day.
Right.
Yeah, and that's not like you said, like, how can you be expected to function like that? So it's something that, from my perspective, and this is, when you were like, what is the best advice for someone in menopause? I'm like, manage your stress. Worst advice ever, but it's really important. And it sounds ridiculous, like, oh yeah, thanks, like, manage my stress. But at the same time, our stress hormone plays a big role in our ability to sleep and maintain our sleep. And so that's just like a piece of the puzzle. You know, we have to, just like we have to eat well and move our bodies and nourish our bodies, like we do have to take care of what's going on in terms of our stress response. And I find that women, I mean, you know, women take on a lot, period. We have a lot going on a lot of the time. And so our stress levels are typically pretty high. And so we do have to figure out a tool or a way to manage that.
You've talked about women's health, but at the exact same time, you also specialize with people, as we said earlier, with depression, anxiety, OCD. What are some things that you could suggest to those? And then we're seeing it even more so now with our youth. Like, it's crazy, like how many teens are experiencing anxiety, depression, OCD. What are some things that you might suggest as for parents even to recognize in their children?
Yeah, it is definitely, like, mental health issues are definitely on the rise in our whole population, but also in that teen, preteen sort of age group. I think the biggest thing we want to do with any mental health issues, take care of the basics. So, you know, for a parent, you know, is your child eating? Are they moving their body? Are they sleeping? Is it maybe too much? Because depression can sometimes make us sleep a little bit too much. And then I find, like, a lot of the time teachers are the one who will pick up on mental health issues in our youth. And so as a parent, like, having a good relationship with the teachers can be really helpful to sort of know a little bit more about what's going on with your child. And, you know, I think as far as general mental health goes, like, having that open environment in your family where you can talk about feelings and talk about how you're feeling and sort of normalize that experience. Teens are made to feel big feelings. Like, they're wired to feel big feelings. They're testing their frontal cortex. And literally people are like, yeah, I know they're testing me. Believe me, I know. But, you know, like, they're testing their boundaries of their emotions. So they feel sadness bigger and more and stronger than we feel sadness. And so some of that has to do with just developmentally where they're at with their brains. And then, but making sure you cover the bases for anyone with a mental health issue. It's always like, you know, you want to treat yourself like a 4-year-old. Like, when was the last time I ate? If I'm feeling really sad and I can't get out of bed and I just feel hopeless and useless and all of this, like, when was the last time I ate? Have I had a shower? Have I gone for a walk? Like, I know it sounds really, really basic, but when you're depressed or you're highly anxious and that can lead to being depressed, you know, just taking those basic steps can feel almost impossible, but they really help. And it's a vicious cycle. You feel like you don't want to do them, so you don't do them, and then it just feeds forward, right? So, like, taking care of basics is really important. And then seeking counseling. There are a few walk-in counseling options locally that are great. But that's really important, and normalizing that too, because I think a lot of people are sort of nervous to talk about getting help, or nervous to say to their friends, like, oh yeah, I went and saw a therapist or a psychologist or whatever. But like, once you talk about it, you're like, oh, everybody does that at some point, or most people need to, you know. And I think that's really valuable and important. And then if we need medication or we need herbs or we need supplements, like, we need to address that. And lately in my practice, I have been dealing with a lot of mental health issues in patients that I've known for years that have never had difficulty with their mental health. They're coming in because they're anxious, or they're coming in because they're depressed. And I think a lot of our like, isolation has taken a really significant toll on people, and there's just a lot more stress going on right now. But I just think across the board, we need to acknowledge it and manage it. Yeah.
What about the OCD? About OCD, is there, like, I know one of the things that can be caused by stress or trauma can trigger OCD. What would you suggest for those that may have someone that they're starting to see OCD symptoms?
Yeah, I think getting an assessment with a psychiatrist, like basically what you want to do is advocate with your family doctor for a referral to a psychiatrist, because a psychiatrist is going to be the expert in diagnosing the psychiatric kind of more advanced, like beyond depression and anxiety. When we're looking at OCD and even ADHD, they are manifestations of anxiety. So they're basically like anxiety on steroids. So when we talk about, like, most people think about anxiety, they think they have this idea of like a panic attack, or like your heart racing and getting sweaty and maybe crying and just feeling like you're going to die. Like that's everyone's sort of like typical image of a panic attack. But anxiety can also be like difficulty focusing, difficulty with attention, because there's so many thoughts racing through your head. And so that can manifest into ADHD. And then OCD, basically the way we understand OCD is that it's basically these behaviors or compulsions that are designed to protect the patient from that anxiety. So a lot of things in OCD are checking behaviors, or like hand washing, especially right now, behaviors where it's like little bit out of control, like and it is often in a certain number of repetitions, things like that. You know, somebody's got to check the light switch 15 times, and if they get interrupted, they have to start all over again. It's the same thing with the hand washing. It's the same thing with any other checking behaviors. And so having that properly diagnosed, like I can diagnose that, but I often prefer to have somebody sent to a specialist. And then I will work on the treatment piece with a patient. Again, just because psychiatrists are the specialists in that area, but we want to really advocate for the proper diagnosis, because a lot of people are misdiagnosed with mental health issues. So we need to make sure we see the proper individual, the proper doctor. In terms of trauma, I love the EMDR technique, which is a specific counseling technique. Eye movement desensitization release, I think is what it stands for. And it's just a really wonderful way to work through trauma. And there's a lot of EMDR practitioners, therapists in Edmonton that do a great job. And I think that that's a really beneficial technique for anyone with anxiety, depression, or OCD, or those more sort of like severe manifestations. Yeah.
Wow, that's intense. There's lots out there.
Lots, yeah. Yes.
Yeah.
Yeah, you're saying that food is a big portion of your mental health. I also follow you on Instagram and saw your post that you were vegan, yes. And then you went back to eating meat. So, I mean, everybody has to do what's right for their body, but is there sort of a best practice you can share on the ratio of meat versus meat-free meals?
Yeah, that's a good question. I always joke with my patients when they're like, what's the healthiest diet? I'm like, first of all, we don't use that word. No, I'm just joking. But, you know, I would call it a paradigm, because everyone wants to know, like, should I eat keto? Should I eat paleo? Should I eat vegan? Should I do this? I always joke that the healthiest like nutritional paradigm would be a vegan diet with a hunk of meat, because basically like you're focusing on those vegetables and those fibers and those fruits that are going to, and there's just so many nutrients and benefits there. Like that should be the focus of our nutrition. Now, like protein is incredibly important. And especially when we look at mental health, protein consumption, and it doesn't matter to me if it's from meat or if it's from plant sources, just so long as the patient is getting enough. And my patients will know that I will ask them about how much protein they're getting. It doesn't matter if they're vegan or paleo. I will be like, are you getting protein at breakfast? Are you getting protein at lunch? Are you getting protein at dinner? And are you getting it at your snacks? Because it helps to keep our blood sugar levels stable. If our blood sugar is fluctuating too much, that all by itself can cause anxiety. You know, when you get low blood sugar, everybody's like, yeah, I get hangry. I'm like, yeah, but what else does hangry feel like? Anxious, right? Like, yeah, like I need to eat. You know, that's so vegetables, fruits, like focusing on that, and then focusing on your protein and just deciding where you like to get your protein from. If it's from plant-based sources, great. If it's from animal sources, also fine. I don't really think there's like a magic like ratio. I think it sort of depends. You know, like in my house, we probably eat vegetarian like once or twice a week right now. Usually we do have quite a bit of fish and meat and poultry, but always like a giant, you know, salad and a lot of vegetables, and it's just such an important piece. I love the new Canada Food Guide actually, because it says to have half your plate of vegetables. I'm like, that's actually really good advice. And you know, we used to rip on the food guide because it was not very good, but I think that was a really positive change. And so yeah, focusing on that. Of course, different people feel better eating in different ways. So like the patients that are like, yeah, like meat just makes me feel gross and I prefer to have plant-based diet, like awesome, I will support you, no problem. Yeah.
That's awesome.
So what would be your favorite comfort food then?
Tomato soup. I love tomato soup, I know. I think that's sort of like my ultimate comfort food, and maybe with a grilled cheese.
That's hilarious that you said the tomato soup, because I just saw a joke today that says everyone should enjoy tomato soup cold with a piece of celery on the rocks with vodka.
I mean, that's not a bad idea. I've heard that's a good drink.
That's a good one, Shauna. Well
yeah,
done.
I didn't make this one up. I just read it today. I was like, that's perfect timing.
Yeah.
So I have a really important question for you to kind of wind us up a little bit. If you were an ice cream, what kind of ice cream would you be, and why would you be that flavor?
Okay, I think I would be like cookie dough ice cream. Yeah, because it's really basic, like it looks basic. You're like, oh, it's just vanilla, but then you get in there and it's like there's all these delicious surprises. I feel like I guess like I feel like on the outside I'm just like your average person, but I have a lot to share, and I want to share that with people, and so I guess that's my sort of rationale behind that choice.
That's good. I don't know if it's me in my happy place.
Yes. So speaking of sharing, before we leave, how can people get a hold of you, and tell us where they can on social media, and tell us more about your new location?
My social media, my Instagram is @DocBrieBots. And I have two websites. I have my personal website, which is just briebotsford.com. That's BRI Botsford.com. And then my clinic is called Flow Functional Healthcare. We are located centrally in Edmonton, 109th Street and 70th Ave. We're in a little dental building. We've got free parking. It's awesome. And yeah, it's great. And yeah, we just tried to create a space that is welcoming and healing and calming, and just, you know, inclusive was something I really valued too when we were developing our space. Was I wanted people to feel comfortable coming here, regardless of if they are, you know, women, men, anything in between. You know, like it's a welcoming place for all humans, and that's what we do, is we help humans feel better. And yeah, that's my warm fuzzies. That's what we, you know, we are focused on that here. And right now it's just me and one other naturopathic doctor, but we're looking at involving more practitioners in our care team. We're talking with acupuncturists and counselors and people like that. We're just waiting for the right fits to sort of expand our team. But like we said, we've only been open for, I guess this is the start of week 4 now. And we're excited to grow and support the community.
That's very exciting.
Yes.
Thank you.
Thank you very much, Dr. Briana, for being with us today, and for sharing so much valuable knowledge and empowering us today with that knowledge, and especially for our viewers that they can reach out to you. I mean, today we talked about some very personal issues, and as you can see, even though it may be personal, it needs to be addressed, and I want to thank you for all that valuable information and being a part of our show today.
Well, you're welcome. Thanks so much for having me. It's so much fun to talk with you guys, girls.
Well, thank you very much, and you have yourself a wonderful summer.
Thanks.
Take care. Bye.
Bye.
Thanks.